Treatment depends upon the exact pathology or exact disease. If it is a hypospadias, the urethra, the penis is bent and patient passes urine from underneath. That requires, by surgically, we have to correct this bend of the penis, that is called chordate, to be corrected. We have to release the urethra, then the penis becomes straight. Then we have to construct a tube. The urethral tube is to be constructed, and child has to pass urine from the tip. That is called urethroplasty, and the urethra to be reconstructed. If obstruction is inside, that is called posterior urethral valve. From the bladder outlet in the urethra, there will be a valve will be there. That will, the urine will not come out freely. That will be obstructed. Then using endoscopically, we have to correct that posterior urethral valve. Then common condition in children is obstruction at the uretropelvic junction, UPJ obstruction causing hydronephrosis. Kidney will be grossly enlarged because the ureter tube starts at the uretropelvic junction. There it will be very narrow. Urine will not come down into the ureter, and that will cause enlargement of the kidney called hydronephrosis. Here the treatment depends upon the grade. The treatment is we have to excise that narrow segment, and the ureter has to be connected with the pelvis without any obstruction in a wide manner, and all large redundant pelvis to be excised, to be repaired. That is called pyeloplasty surgery. All these procedures can be done using laparoscopy. Another common condition is vesico-ureteric reflux. Urine from the bladder goes back into the ureter. If it is a minor reflux, that we can grade into grade 1 to grade 5. If it is a minor grade, sometimes we require only conservative medical treatment. As the grade advances, that require treatment. Nowadays, a treatment called deflux injection is available that can be injected into that ureteric orifice, produce a transient block there so that urine will not go back. But severe reflux grade 3 and more requires surgery because that will repeatedly produce urinary infection and kidney failure also. So to prevent that, that requires treatment. That is an anti-reflux surgery. Urine should not go from the bladder into the kidney. That is the aim. And that can be done as laparoscopic anti-reflux surgery. That is, through the bladder wall, we make a trough, put the lower ureter into the trough and repair it. A good support has to be given so that urine will not go back into the bladder. That surgery can also be completely done using laparoscopy surgery without the need for a major surgery.